I'm Judy Wood. I'm the Director of Nursing here at Advantage. I've been here for 7 years. Prior to coming to Advantage, I worked at the hospital. I worked in med-surg, mostly orthopedics and renal floor, and then I worked in the ICU for 6 years, where we saw everything in the ICU. Was a little nervous about coming to home care because it's a lot different. But it's really nice to see patients in their home, to see what they're actually dealing with every day, as opposed to what they're dealing with in the hospital. And obviously nobody wants to be in the hospital, so that's why it's fun to be in home care, because patients are where they want to be. They're in their home. Sometimes I talk to the students I work with at Malone. And one of the stories I tell them about home care, which is the kind of way you could help a patient that you could not help a patient in any other nursing setting. So I had this patient and she was unable to get upstairs to the bathroom. And so she was using a bucket to go to the bathroom in. And I said to her, well, why don't you have a bedside commode? Because at least you can sit down and you know. And she said, well, they don't make them big enough. And I said, well, yes, they do. There's things called bariatric, bedside commodes. And so we got on the phone and we called her case manager through her Medicaid. And the next day she had a bariatric bedside commode that she could actually sit down on and do her business. So, it's not the kind of thing that as a nurse in the hospital you ever would think about, because you just assume that everybody has the equipment they need at home or that they're able to get to the bathroom. So you don't recognize those little things. And I feel like even though it was a little thing, it made a really big difference in her life. So my cousins are very close and we like to do things together. We sew, and we had a knitting club here at the office for a while, knitting and crocheting, and so we're kind of thinking about bringing that back, which was just a nice time to get together and share your love of yarn. So yeah, that's about it. So I really see that home care is the future of healthcare. Hospital stays are shorter, nursing home stays are shorter. There's so many things we can do in the home that can be done other places, and it's where the patient wants to be. The patients want to be at home with their family. So I foresee that Advantage is going to change with the times and move into the future and be able to meet patients' needs at home.